When forgetfulness becomes a message, warning signs of dementia doctors want you to recognize. Everyone forgets things sometimes. But what happens when forgetting starts changing the way a person lives, communicates, or makes decisions? That is when it deserves more attention. As a doctor, I want families to understand that dementia is not simply a normal part of getting older. It is a general term for problems with memory, thinking, language, and daily functioning caused by diseases affecting the brain. One early warning sign can be memory loss that interferes with everyday life. A person may repeatedly ask the same question, forget recent conversations, or depend increasingly on notes and reminders for things they previously handled easily. Another concerning change is difficulty completing familiar tasks. Someone who has cooked the same meal for years may suddenly struggle to follow the recipe, or a person who regularly manages household finances may begin making unusual mistakes. Pay attention to changes in language and communication. A person may struggle to find common words, lose track of conversations, or repeatedly use the wrong words. This is different from occasionally forgetting someone's name and remembering it later. Getting lost in familiar places is another important warning sign. Someone may become confused about where they are, or have difficulty finding their way home from a location they have visited many times. There can also be changes in judgment and decision-making. For example, a normally careful person may suddenly give away money, fall for obvious scams, or make inappropriate financial decisions. Sometimes the earliest changes involve personality or behavior. A person who was previously calm may become unusually suspicious, anxious, withdrawn, or irritable without an obvious explanation. Finally, watch for difficulty managing everyday activities. Problems with dressing, preparing food, taking medications correctly, or maintaining personal hygiene can indicate that cognitive changes are beginning to interfere with independence. These symptoms do not automatically mean dementia. Depression, medication side effects, vitamin deficiencies, thyroid problems, sleep disorders, infections, and other medical conditions can sometimes cause similar problems, and some are treatable. If you notice persistent or worsening changes in memory or behavior, arrange a medical assessment rather than assuming it is simply aging. Don't label someone forgetful and move on. Sometimes a change in behavior is the brain asking for medical attention. Early evaluation can provide answers, identify treatable causes, and help families plan appropriate care. Please like, share, and subscribe for more medical advice, wellness, and to know when new videos are uploaded in this channel. Thank you.